Hello, everybody, and thank you for tuning into the Liberty Report. With me today is Daniel McAdams, our co-host. Daniel, good to see you.
How are you this morning, Dr. Paul?
Doing fine, trying to sort things out, as usual.
Yes.
But I would like to say that there's a little bit of good news.
Yeah, for sure.
Because some truth broke through here in the last day or two, and we've sort of talked a little bit about this, but it looks like even the bad guys are admitting it. And that is, they made these dire predictions so that they can go ahead and destroy people's civil liberties and spend a lot of money and make up an excuse on why the stock market actually went down, all kinds of things by having this coronavirus event blown way out of proportion. And once again, very serious, but we had a lot of serious illnesses this period of time, that we could sit here and recite into the tens of thousands, if not hundreds of thousands of people, if you added up everybody that has the influenza and other things. But anyway, it's been done, but now it's looking like that the people who promoted this, the most guys like Fauci, they are admitting that maybe they overpredicted, because what we were saying, it's not this bad. But you know what? They're pretty adaptable. They say they didn't overestimate. They underestimated the ability for them to contain the virus.
Yeah.
This is positively amazing how they're going to get credit for this now. And therefore, they're not willing to give up. This is just, for them, a step in saying, we've been so successful, and some people are going to say that, it wasn't as bad as we said, but they have to have a way of saving face, so they declare victory. At the same time, what do? They're starting to condition people for the next crisis, because it's going to be bigger than this one. And when you have Bill Gates, billions of dollars, promoting this one world nonsense, that we can be sure it's going to be around. But, people will respond to hearing the truth. And even outside our station and others who are like-minded, it's breaking through on ordinary media and say, hey, the numbers are wrong. It's not as bad. But so far, they haven't relieved many states, but there are some states that we can compare them to. Some states didn't have as much control as the others. Yeah. And I think that's where we can refute their nonsense about why they should claim credit, because the more authoritarian they were, they says the more lives they saved, but they never count the lives that they contributed to destroying by putting everybody in their house and making them prisoners, because we haven't heard the end of that. This morning I saw something about, domestic violence has gone up because people don't like to just sit in the house and end up arguing and fighting. So there's a lot of downside to this. But anyway, the news is that the people, Fauci and these other ones, are admitting, things are not so bad. But you better listen to us, because it could come back. It will come back, and you need us desperately.
Yes, exactly. And you remember, we cannot forget this. The original claim from Fauci was 2 million Americans will die from this. And then he said, if you listen and do everything I say and shut the whole country down, well, maybe we'll get away with 240,000 deaths. And then it kept going down. So I'm going to go back to something we said yesterday, Dr. Paul, because I think it's critically important. And put up that first slide. These are the statistics that the U.S. government uses to gauge what's happening. And now they changed it as of yesterday, saying that at the max it'll be 60,000 deaths. Okay, that sounds pretty bad and pretty terrible. But once again, let's look at the next slide. 60,000 this time. 80,000 died in 2017, 2018 from the flu. So less people will die from this so-called pandemic than actually die during the flu. And as you point out, what Fauci and the others who have completely been wrong, what they claim is, well, it's because you listened to us, and thank goodness we shut everything down. Well, let's think about that for a minute, because thankfully, not all the American states issued lockdown orders. And there wasn't Trump very wisely did not issue a national lockdown order. He resisted it, despite what Fauci said. Some states didn't do it. Some states did a little bit. But I thought it would be interesting to compare Colorado with South Carolina. Both of them have similar populations of around 5 million people. Now, Colorado, under its Governor Polis, has a very strict shutdown. very hard shutdown. South Carolina, up until a couple of days ago, was pretty mild. They had they had no stay-at-home order, no business shutdown, pretty mild. So if what Fauci and they say is correct, that it's only their mitigation shutdown that prevented a massive 2 million deaths, then South Carolina should have an explosion of COVID-19 deaths, and Colorado should be low. Well, guess what? As of this morning, Colorado has 193 deaths. South Carolina, that didn't close their economy, only has 63. A third as many deaths in South Carolina. Now, of course, there are other factors, but just looking in general, other states, finally, Dr. Paul, that did not shut down or very minimally shut down have a similar very low death rate. Arkansas, only 18. North Dakota, 4. South Dakota, 6. Wyoming, who did nothing, 0. So it doesn't back up what they're claiming, that only the shutdown prevented these deaths.
Well, you know, the individuals who promoted that and warned us and tried to scare the country and has really terrorized the people, and the people have rolled over. And now they have to save their philosophy and say, well, it all was good. It was our policies that really helped. But, you know, the other thing that creeps in here is they're not going to go away. And they have to, in a way, save face, because their credibility is on the line now, which is good. That's what really needs to be done. The credibility of the ideas they're perpetuating. But Fauci and Gates, they're not going to give up, nor will the other authoritarians in government. I mean, there's not many in government right now that's willing to even talk about this and say there could be a discrepancy here. But you don't want to have your philosophy criticized, so they have to paint it in a different viewpoint. But the other thing is, they have to get the people ready. You don't go to sleep. This is not going to end in a month or two. And Zero Hedge had an article that they reproduced, and they have some quotes in here from Fauci. And I want to read them because it tells you a lot. It tells you what their thinking is and why they have to be listened to, because a lot of bad stuff's going to happen. No matter, even if those people who advocated caution, and even though it wasn't anything like the flu virus, we still have to maintain the aura of being successful here. So I want to read a couple little things that Fauci said. He says he made it clear, that's Fauci, however, that the virus is never going to disappear and things will still be different even after we finish going back to normal. So it doesn't matter going back to normal, we still have a problem. And then he goes on. When we attempt to get back to normal, we have to place the ability, when it starts, to try and rear its ugly head. It can absolutely suppress by, this is what he wants the government to do, suppress by identification, isolation, contact tracing, he said. And then he goes on. When you're talking about getting back to normal, we know now that we can get hit by a catastrophic outbreak like this, again, so be aware. It can happen again. So we really need to be prepared to respond to a much greater problem.
Yes.
And that's the whole thing. That's the problem with authoritarianism and what's happened in the last 100 years, that you take care of one thing, and now we're in the midst of an economic crisis that we have to be prepared. And we always took care of our downturns. We always bailed out everybody. In a way, this is what we do here. They're sort of bailing out the situation, but the big one's still coming. Yeah. So the philosophy is there. They would like this philosophy to stay alive and well, but ideas have consequences, and what we sense today is that a few people are starting to wake up. And hopefully it will be an explosion of interest. Say, why did we listen to this guy? I'd like to go out in the park. Yeah. This whole thing in our own hometown, they're closing down the golf course. And it's been open all this time. And we had like one bad case in the whole county. I mean, we've not really had to worry a thing about it. So they're closing down the golf course. And the governor says, we're going to close down all the parks. And I happen to take a walk every morning in a park, and 2 or 3 people, we go out there and walk. I've done it for years. And that may be in the category, closing door. That's really going to help me because I figure that's where I get my vitamins and get back to normal is out doing that walking. So this preparation, this mentality has to be challenged. Yes, we may do better and get by, and the people say we're sort of going back to normal. Don't be impatient and all this. But what we want to do is get back to normal when we have a government that protects liberty and doesn't pretend it can take care of us by monitoring every move we ever make. And when there's an economic or a war crisis or a health problem that the government is really needed, that's when you really don't need the government, because most likely they have contributed to it, and most likely their interference will make it worse. When it does settle, they're going to say, all this mischief made things worse. I am convinced that it has, all the intervention that we've been putting up with for the last couple of months.
Absolutely, and Fauci claims it'll never disappear. It could come back. It'll come back in the fall. Well, everything that he is doing, everything that people that listen to him are doing, will guarantee it comes back. Because the way that the human beings, we've had viruses since we've been here. And I'm not an expert. This is basic stuff. The way we get over it is we develop community immunity, herd immunity, however you want to call it. People are able to defeat that virus mutates and gets weaker and goes away. But now what he's doing by keeping everyone in, we're not allowed to get that community immunity so that the virus can be killed. So yeah, it will come back stronger and more people will die. But the good news, again, is, and we talked about this the other day, is that there is a growing resistance. And actually, here's the next slide, Dr. Paul. This is a good little piece of encouragement for us today. Look at this. War over Easter. Kansas lawmakers revoke Governor Kelly's order limiting church gatherings. And this is what we were talking about in some of the other states. What happened is she came down there like a little dictator and said, no churches. And the state legislature met and said, oh yeah? No, we don't think so. And they overruled her. So a lot of this is happening, and it is very good. But the other thing that's happening is just show how crazy and how incompetent the so-called experts are. Let's go to the next slide, Dr. Paul, because this is interesting. This is from a former Manitoba in Canada Chief Provincial Public Health Officer. This quote is really worth reading. He's also a professor at the University of Manitoba, and he's a director of the International Center for Infectious Diseases. He said, in 30 years of public health medicine, I've never seen anything anywhere near like this. And I'm not talking about the pandemic, because I've seen 30 of them, one every year. It's called influenza and other respiratory illness viruses that we don't always know what they are. But I've never seen this reaction, and I'm trying to understand why. And he's a professional. He said, sequestering vast portions of the population is an extreme measure to take when there's so little proof it works. Here's Dr. Kettner again. We actually do not have much good evidence for these social distancing methods. It was just a couple of reviews in the CDC's Emerging Infectious Diseases Journal, which showed that although some of them might work, we don't really know to what degree, and the evidence is still pretty weak. So the evidence for all this social distancing is not even there. You have to wonder if it's some kind of psychological manipulation.
Of course, a significant move would be to get rid of Fauci for giving us all this information.
Yeah.
It doesn't look like that's going to happen.
It may.
Well, let's hope so. But, he works for CDC, and it's not exactly the typical government organization. It's an organization that Bill Gates owns, and I'm sure Fauci benefits from this tremendously. So that's not likely to happen, but I think the type of firing it probably may be on your mind, and that is he should be fired. But if you don't do it in the literal sense, the people have to fire him. Yeah. And they have to fire him by saying, he's a fraud. Yeah. He doesn't give us any good information. They didn't save us from ourselves. And his plan to give us total control of everybody and getting, the plan that they have is when things are getting back to normal. Yes, people can return to their work and they do things and go to the golf course. If you get a stamp of approval, your liberties are there if you get the proper stamp from the government and say that, well, you're free of spreading any disease. But as this one goes away, they'll come up with another one. It's just an excuse to have total control over the people. But I think the most important thing is people have to quit listening to him. If they're going to listen to him critically. You know, what is he saying? What do other people say? And I'm delighted that we have so many viewers tuning in to find out what we're saying. But there's other people too. Find the other people are saying, or encourage other people. I mean, if you can call into talk shows and things, let people know. And a lot of people just wait back and find out, oh, they are saying something. I'm not the only one that think this is a fraud.
Exactly.
And then our side can grow exponentially because we're on the side, I think, on truth on this. But I think that the one thing is we approach it with the protection of personal liberty versus everything they talk about is amplifying and depending on the authoritarianism of a bunch of people that are in government that will do it with the force of a gun. I mean, people have been forced with guns now.
Yeah.
You know, if they're doing something wrong, the police show up, you quit doing this. But when they start, and they may have already, they'll start knocking on the doors and the churches, you know, this sort of thing. That's why the churches, there's been several have stood up to it and give them a little courage. And maybe next month they say, you know what? We went to church and we had 2,000 people there and nobody got the virus. You know, and that's what they're going to find. They'll find out that people probably got some colds, maybe somebody got the flu, and maybe somebody did get the coronavirus. But it's not like you know, everybody's at the hospital. Matter of fact, the way this is going now, people are afraid to go to the hospital because they're afraid somebody's going to label them. And the hospital have more beds available. And yet we put these military hospitals out there, and they're not being used.
They're empty.
You talk about government making mistakes. It's endless. And this is a serious problem. But the problem is overreaction and not getting the truth, and our government's deceiving us. I think there's a lot of analogies to how they get us into war and how they perpetuate the war, and you're unpatriotic. And people already now are squealing on their neighbors. Hey, he didn't have his mask on. You know, because they're told that you're being a good person. You're being an American. You're being concerned about your neighbors. Well, why don't you be concerned about your liberty, your family's liberties, your neighbor's liberty? And believe me, you're not going to make more people sick. I just don't believe that for a minute, because when you need distribution of health care or any kind of service, the government is lousy at it. And that's why we should never depend on the government for the distribution of health care services or anything at all. And that's why the dependency on government is the culprit. And maybe we can get a lesson learned from this and find out that we should question exactly all the information we're getting. And there's a few now, even on the regular stations, will pop in a half-decent report on this. Say, hey, maybe Fauci hasn't said it right. But the one thing is, they will really do it if they say, oh, that's Trump. We can blame it on Trump. Say, if it's Trump's fault, then they're going to join in, which is a farce. But he could rein in Fauci a little bit. I think that would be beneficial.
Get him off the screen, and we know that we believe that Trump watches Tucker Carlson, who's been pretty good on this, I have to say, in the mainstream media. So hopefully he'll take that on board. But speaking of Fauci, like you said, people should look up his real record. You know, if you remember back when the AIDS crisis hit, he was massively, massively wrong. He massively exaggerated the threat of AIDS in the heterosexual community. Massively. He caused, remember the AIDS scare, a huge scare. Now, of course, it's a serious thing, and obviously something to take seriously, but that's what he did before. And what they want to do now, look up ID 2020. This is Fauci and Bill Gates are working on this. They want to have, and this is not tinfoil stuff. They want to, if they have a website, they want to have biometric implants, like you said, to show if you've had the vaccine
approval,
or not,
get the approval
to track you. So, and you mentioned face masks, and actually let's put on the next one because it talked about mixed messages, Dr. Paul. Everyone's got these face masks on. You've got to put on your face mask or you hate everyone. The World Health Organization says there's no need for healthy people to wear face masks, days after the CDC told all Americans to cover their faces. So nobody knows what they're doing here. Only trying to do is selling fear, I think.
Well, we have a leader in the White House right now, so we should take his lead on this. He doesn't like the stuffiness of having a mask on.
Yeah, so, absolutely.
I just think that we're having a breakthrough here. They're being discredited. It's sort of like in the war in Syria. As soon as there was a breakthrough, they thought, oh well, we better watch out. We're losing. But no, Assad was winning, and that's why they had to respond to it. So as soon as it looks like one side's winning, they have to go after him. So right now, I think we were getting some knowledge out. We're getting more to the bottom, the truth of this. But there's still a lot of people who are glued to the television, and they've been scared.
Mainstream
so getting
media.
Unscared is not easy, but that'll be a job. But we're going to stick with it.
I have another one, Dr. Paul. You're going to appreciate this. I thought of you when I put these two together. Let's have that next slide if we can. This is something that is not going to come as a surprise. No, let's skip a couple actually. Right here, yes. No, go back, please. Irish studies find vitamin D can build COVID-19 resistance. Of course, you've been saying this all along. Vitamin D is good. It kills these viruses. So what happens a couple of days ago in Texas where we live? Go to the next one, please. Governor Abbott orders the state parks closed. So look at these people over here in the picture. They're building their vitamin D. They're building their immunity to this virus. And Abbott says, don't do that. Just stay home in your dark houses, So it shows the absurdity. But, a lot of people complain about our program. You always talk about what's wrong. You never tell us what we can do to fix it. Well, here's one thing I think we can do as an action point, especially Texans. They should call Governor Abbott's office. He should be flooded with calls saying, let Texans get back to work, And at the local level, he talked about shutting the golf course. People should call our city manager. What are you doing? Why are you closing these parks? This is what we need to get healthy. So there is a lot of action. We can flood these officials. Now they're starting to be a little bit frightened now. Hold on a minute. And this is our time to act.
Well, the best way to approach this now is, Governor Abbott, you're ruining the image of Texas.
Yes.
Texans are supposed to be strong and independent and willing to take care of themselves, willing to get a suntan, especially when it's helpful. But you're doing the wrong thing at the wrong time. Matter of fact, you're a little late anyway.
Yeah.
Everybody else, we're on the way. We're getting over this thing. But I don't know. It's sort of the herd mentality, and it doesn't all happen at one time, and every state's a little bit different. But I tell you what, it shouldn't be different. People used to ask me, how can you represent farmers and also city folks? Well, because liberty is beneficial to everyone equally. And that's why if liberty and local choices are beneficial to everyone, it doesn't really matter whether you live in a small state or a big state. It may need, more liberty in a city like New York, instead of needing to have roadblocks, because maybe people would go. Maybe they'd go see a cousin, outside of New York City. So they put, oh, you're not coming into our state. It's just so distorted. But there are a lot of common sense things that people would do. And of course, the statistics aren't nearly as big as they claim. And that's the big problem, because it's reversing this atmosphere of fear that is the big job that we have.
And we find out from the New York's own numbers that 86% of the people that died there had other comorbidities.
Yeah.
So that's what we see. But I'll just close with a couple of things, Dr. Paul, and talk about some good news. I want to end on a high note. We need it. But let's have that next clip. I was looking over our analytics today, Dr. Paul, and over the past week, we've had a 595% increase in our subscribers to this Ron Paul Liberty Report on YouTube. So that makes us feel good, because we work hard to put these together, and we want people to please do subscribe to this channel and get a lot of good news. The next clip is also good news. We're having lots of good news today. And this is something I was surprised this morning when I was working. I was looking at the Drudge Report, and look at that up at the top. Ron Paul, resistance building to house arrest orders. It's about time. He doesn't often link to our stuff, and we're grateful that he did. And the message is getting out like mad, and that's why we're working so hard. And I would just remind people, if we can have the last clip up, that we don't ask a lot, but it does take a little bit to put this show on. If you can click over to ronpaulinstitute.org, you can click that support button and help us continue this show and all of our other programs, by the way, that we do during the year with a tax-deductible donation to the Ron Paul Institute. Help keep this alive and help us continue to inform all of you. And thanks for watching.
Very good. You know, one of the things that, one of the explanations I use when I'm promoting our cause, the cause of liberty, is the fact that it is attractive to everybody. And if you understand it, whether you're a conservative and you have conservative values and you go to church versus somebody that they have no faith and they have certain social values, that they should be fighting for liberty because it means the government doesn't come in and close you down because you have such practices, or how you spend your money. In a free society, you get to decide these things. Liberals don't like that because they like to spend your money too. But if you offer this up as something where each group wants their liberty, you don't have to have the agreement on social policy. And I think it's one of the easiest things, if they heard the truth, they would be very resistant to war. Nobody, you know, I always use the argument, how often do we see young people from 18 to 25 getting together and starting parading? We need a war, we need a war. Never. It's all the people who are manipulating us and maneuvering us into war. It's been that way all along. But young people don't want it. Most people don't want war. And the peace candidate usually does better than the war candidate. And But if you take this issue of health, why should the health be different for a rich person, a poor person, or anybody else? What if the very natural things that are good for health and medications that can be helpful, why shouldn't everybody want the best distribution of health care? Well, we do have to convince people that the best distribution of any goods or service is through the free market. It's not through the government. What we're looking at and criticizing every day, we're looking at the government distribution of providing safety for us. So this is the reason I remain very optimistic on the issue of liberty. And if we could get more people to accept this and analyze this pseudo crisis that we have with the coronavirus, then I think we can make progress. It does not mean that we ever belittle anybody that has sickness, because I personally believe the world is better off, whether it comes to health or safety or peace. These all are done with the least amount of governments, and there are some governments that are very, very small. They just don't bother going to war, and some of them don't even bother having an army. So I tell you what, the answer can be found in the understanding of personal liberty, something our country used to be known for, but not anymore. Right now, we have to challenge the Faucis of the world, and we have to decide how we can silence them, yet we can't use force to silence them. We could deny them government money, which we should, but we also can immediately stop listening to these people who aren't telling the truth and seek out the truth and challenge the people who are giving us all the untruths through the conventional media. I want to thank everybody for tuning in today to the Liberty Report. Please come back soon.